Tell us a little bit about the recovery period, because I think that's probably also a big concern. Now you've had the surgery, what happens after that? The pain, how do you manage that? What can you expect after you have a major surgery like this? What would you tell your viewers that they should expect and could prepare to do in the aftermath of the surgery?
Yeah, first of all, one of the things I didn't like about the surgery, I had to go on all these drugs. I had to take pain meds and Tylenol and heparin and, all this stuff. And in the post-op course, they gave me a narcotic with Tylenol in it, and I didn't want to take it. I really didn't want to take it.
You don't like to take
No. My biggest fear of taking narcotics was getting constipated, and then, stopping the flow of energy through the gut. So basically, I ended up taking only 2 narcotics, 2 pills out of 48 that was prescribed for me. I just took 2 in the entire post-op period, and I was fine with that. I slept grounded. I put an electrode on my foot and plugged it into the wall socket. I have good grounding in my house. And I got to tell you, the first or the third night when I got home, actually I was home after the third night. The fourth night, even when I was injecting myself with heparin, I had a lot of swelling of the what we call the iliotibial band. So I could stick my finger in the side of my thigh, and it would pit. I could stick it in almost like a quarter inch. And I spoke to my associate, Clint Ober, who co-authored, the earthing book with me, and I said, do you think I should put a patch in my foot? He goes, absolutely. Treat yourself like the Tour de France. And guess what? I put a patch on, and the next morning, all the swelling was gone. And then I said, oh my gosh, I am going to heal so quick, it's going to be amazing.
That's interesting. You are a huge proponent and have been for a number of years on grounding. How instrumental do you think the grounding was in your recovery, in your healing period?
Oh, I think it put the fire of inflammation out. Remember when you cut, you got a lot of inflammation, and inflammation causes pain. So when I slept grounded, and when I put my feet barefoot on the grass, because remember I got surgery in June, so I would walk out in the sun, put my feet on the grass or on a slate patio, and I would sit there. I'd be soaking up vitamin D, being grounded at the same time, and I said to myself, boy, am I healing, and I healed quickly. But I gave myself positive intention. So I healed very rapidly. In fact, I played in a hospital golf tournament, a full 18 holes of golf, 5 weeks after surgery.
Wow, that's amazing.
It really is. And I walked, and I'll tell you, it was a sleigh ride.
During that period where you continued to take vitamins and supplements, you're also a huge proponent of those. Did your regimen change from pre to post recovery in terms of your vitamin supplementation?
Yes. After I was finished with heparin, I was taking much more anti-inflammatories. I was taking Medizyme, digestive enzymes. These are like bromelain, trypsin, chymotrypsin, pancreatine. These are enzymes that are used to digest food, but it's similar to wobenzine, like the East Germans and the Bulgarians used in the Olympics, the women's teams, because they put the fires out of inflammation. So I was taking, enzymes, which really helped. Again, when I was off heparin, so it was a week later, I was also taking serapeptase, which is it lyses fibrin. I was taking nattokinase. I was taking omega-3 essential fatty acids, squid oil, fish oil. So yeah, I was giving myself lots of anti-inflammatories. I didn't want to take Motrin. My doctor wanted me to take aspirin. I did take the aspirin, baby aspirin, a full aspirin every day. But I only did that for about 4 weeks. I just wanted to go on my own program.
Your concern with aspirin was what?
Well, venous thrombosis. In other words, one of the side effects of hip surgery, this is why you get an ultrasound like 4 weeks later, is to make sure you don't have clotting in the great veins of your leg. We call that venothrombosis, where you can get thromboembolism. That's why pulmonary embolism can be a side effect of hip replacement surgery. One thing I didn't do was fly on an airplane. I listened to my surgeon, and I took aspirin up until the point where I had an ultrasound, and the ultrasound showed that the blood was flowing through my veins. That's when I switched over to, my world.
How, in terms of your speed to recovery, how much further along were you, do you think, as a result of employing both conventional and alternative therapy in this program?
Well, I was walking between 1 and 3 miles a day at 5 weeks. I was walking my dog. Oh, that was such a wonderful experience. I was walking my dog. I really connected with my chow. She and I would walk 3 times a day. She would look forward to it. I would look forward to it. So I had really power healing. And the fact that I could play 18 holes of golf, do a hip turn, you know, twist my back, it didn't hurt. And I was walking, you know, I took a cart, but I was walking a lot. I expected to only putt or play a short iron game, but I was on a tee. I did it, and it didn't hurt. So I just felt good about it.
What 3 pieces of advice would you give the average person about hip replacement surgery today?
Well, whether it's hip replacement or any form of surgery, you must go into it with a positive attitude. You must be positive. Remember, whatever we think becomes true. Now, that's the new medicine. I call it vibrational medicine. This is what I lecture on all across the country. This is the Einstein theory of relativity. In other words, energy follows thought. You know, the equation is E equals mc squared. But I knew that if my thoughts were positive, I would have a positive outcome and positive energy at the same time. I told all my patients with heart disease for years, think positive. You will get through this. They would say to me, oh, doctor, I have heart failure. You know, my family practitioner said to get my affairs in order. I said, absolutely not. If you want to get your affairs in order, that's great. But you're going to be here in 6 months. And I would program my patients, and they would say, you really think I'll be here in 6 months? I go, absolutely. You know, you take the conventional medicines your doctor's given you, you take, you know, my supplements, you know, follow my program. You know, I call it my cardinal pillars, you know, or my, you know, my 5 or 6 step program, and I include grounding in that. I say, if you follow my program, you will get well. And I had a lot of confidence in it. And I think I inculcated, that's the word, I inculcated that confidence into my patients. And even with cancer, I mean, hey, look, it's not over till it's over. And Bernie Siegel, you know, I used to love Bernie when we workshopped together. Even in a dire circumstances, he would always say, there's always hope and a prayer.
That's really a nice thing to say. Dr. Sinatra, thank you so much for joining.
Oh, great. This was fun.
It was a pleasure.
Thanks, Donna.